Good afternoon, live from the ZTN studios in Harare, Zimbabwe. Welcome to this discussion on World AIDS Day. Now, World AIDS Day is commemorated annually, globally, on the 1st of December. Now, this year the theme is Global Solidarity, Shared Responsibility. This program is brought to you by Zimpapers Television Network with support from PEPFAR through USAID in partnership with OFID and NAC. As always, your contributions are important to us, so please make sure that you're chiming in on the discussion using the various platforms available. If you are watching us on Facebook, then of course it is Zimpapers TV Network Facebook page. And if you want to be part of the discussion on Twitter, it's at ZTN News. Make sure that we hear your voice in this discussion. My name, of course, is Candice Mwakaliele. Now, Zimbabwe has been making progress in addressing the HIV and AIDS pandemic. Reports indicate a general decline in new HIV infections, an increasing number of people getting access to HIV treatment, and a general improvement in the health and well-being of people who live with HIV and are on treatment. Of course, the Organization for Public Health Interventions and Development, OFID's Community Support Specialist Patricia Mbeu, the National AIDS Council, NAC's Chief Executive Officer, Dr. Bernard Madzima, and the Zimbabwe National Network of People Living with HIV Programs Manager, Clarence Mademutsa, are in the studio to help us take a look at this particular significance of this particular day, as well as the theme itself, and ensuring that targeted efforts are there to ensure that all people living with HIV who do not know their HIV status are reached, and that testing services and support are available for them to be able to get on treatment should they be positive. All people living with HIV who know their HIV status get ARV medicines and receive the necessary support to stay on treatment. All people living with HIV are empowered to achieve viral load suppression and live healthy lives. Groups of people living with HIV and other civil society organizations involved in HIV and AIDS initiatives, response initiatives, mobilize in support of the communities that they serve and to raise funds. And also that the events highlight the current state of the pandemic, the epidemic rather. So, of course, let me welcome my guests to the show. Thank you so much, all of you, for joining us. And just to, get us started off, I will start by asking, so as we're joining the rest of the world in commemorating World AIDS Day tomorrow, and we have heard our theme, maybe, Patricia, let me start with you. What exactly would be your interpretation of this year's theme?
So this year's theme, obviously, is making sure that everyone is hands on deck. We are looking at the governments. It's our government, Zimbabwe government and Ministry of Health and NAC actually bringing partners together to make sure that we approach and address the issues of HIV and AIDS from all angles. Like you mentioned, making sure that 95% of people know their status and they are on treatment and they are retained on treatment. So it's 95, 95, 95. So basically, we are looking also at harnessing resources through donors, through government initiatives, to make sure that all are put in the same basket to achieve this.
All right, thank you. Dr. Madzima, let me bring you in. Your thoughts on the topic?
Thank you, Candice. Thank you for having us here. Like what my colleague has said, we are commemorating World AIDS Day tomorrow, but we've had 1 week of pre-World AIDS Day events. The idea really is to alert people, to make people aware that the AIDS pandemic is still with us, and it's even more important now when we have COVID-19, where there's a threat globally of a fight for resources. The resources which have been used for the HIV program over the past 2 decades are also now looking at fighting COVID-19. So this World AIDS Day is critical, and the theme really resonates with what we want to achieve: global solidarity, shared responsibility. Everyone has to be on the deck. I think people realize now that no one is safe until everyone is safe. So we are commemorating this tomorrow here in Harare, but it's also happening globally.
All right. Clarence, your thoughts?
Thank you, Candice. So I think definitely, as my colleagues have said, it's that coming together, different stakeholders coming in and supporting the response to HIV. People living with HIV, communities, CSOs, government, international agencies, local agencies, financiers, all those sectors and players coming in together, working together to effectively end the epidemic. So that is really the crux of the theme and the message for this year. It's all of us coming together because the epidemic has not yet ended. So we still have a job to do, and it's a shared responsibility. No one should be burdened with that responsibility to end the epidemic. It is only through the collaboration and the contribution of all the sectors, media, everyone combined. That's how we'll be able to effectively end the epidemic.
All right. Now, Patricia, when we look at this theme, in Africa, obviously the African perspective, how do we achieve such joint responsibility when we consider that, there's issues of financing involved, there's healthcare systems that need to be revamped, that need to be brought up to book with, everything else, all the patterns that are going around globally in terms of HIV care. Even just simple things like access to treatment are not as simple as they should be. How do we bring it home in the African context and make it make sense?
So, as the theme says, solidarity, this is actually starting maybe even at the smallest unit, the household, where we are saying, it doesn't have to be through Ministry of Education, doesn't have to through which ministry. Every ministry is working with the individual. So if a child is going to school, they are also given lessons on HIV, and the ministry has got curriculum. Ourselves, we are aligned to the Ministry of Health and NAC through those two arms, the technical and the policy. We are making sure that all policies are reviewed each year. The reports that we submit to the ministry, for example, are taken seriously and they are reviewed on a quarterly basis, and programming is evidence-based. So all those gaps are recorded, and we make sure that we then sit together in technical meetings that are led either through NAC or through Ministry of Health, to make sure that technocrats come together and support, to improve, come up with innovations to make sure that we address the issues. The fora like the AIDS World Day, where there's a global theme, and every country is doing something towards making sure that we bring solidarity to the table. So I think the issues of system strengthening also are very key, where if I were to give testimony for OFID as an organization that has worked very closely with ministry for the past decade, where we are looking at supporting at every level, starting from the facility, the clinics, in making sure that the health services providers are trained, making sure that access to medication is made available, where there are gaps, even if it means recording, registers and so on. As partners, we step to the table to support the government to make sure that all those things are there. And the one thing that we have enjoyed as partners, working with the ministry and being funded by donors like PEPFAR and USAID, is that ministry has always opened their hands to say, come on board, let's work together and provide leadership. So the innovation is endless. It's an arena where multiple partners come in, whether you're facility, whether you're community, whether you're from the people living with HIV, everyone is allowed in and they share. And we're also looking at the rights-based approach also to programming, where advocacy has gone round. People are educated to claim that space for being healthy, to claim that space to make sure that if they did not have good services at facility, they can even raise the issues. Patients' charter, we had to carry it around to make sure that facilities are provided with information. So really, globally, from the smallest unit to worldwide, it's a casserole dish. Everyone is putting in what they can from all facets to make sure that we achieve eliminate the global pandemic.
Okay. Now, Dr. Madzima, you know, this is a global theme. It means that everybody is coming together. But when we look at Zimbabwe, for example, we still do have issues of discrimination and stigma. What efforts are being put to make sure that everybody is on the same page and is sharing the responsibility of pushing for the entire total elimination of HIV and AIDS in the country?
Yes, so as Zimbabwe, we had actually done very well in terms of achieving the 90 targets, the one alluded to by my colleague. But we note that we have pockets of what we call key populations. Those are the ones who have been lagging behind in terms of, if you look at the prevalence of HIV in those communities, even the incidence itself, the cases of new infections.
Sorry, maybe I could also ask you to just break down the key areas, the key populations
The
themselves.
key populations.
Yes.
Yeah, as Zimbabwe, what we define as key populations are those who are vulnerable. I can start with the adolescent girls and young women. They have got high incidences of HIV infection. But we also have people like artisanal miners who are doing mining in the informal sector. We have what we call the MSM, the men who have sex with men. We have the sex workers. Yes, so those are the pockets where incidences of HIV are higher compared to the general population. So what we have done is we've come up with programs which we are calling models, which try and address those specific key populations. We have programs which are, for example, there's one which is called the peer-led program, where we have peers doing work in the community to the affected constituencies. We also have what you call the sister-to-sister programs. We have the brother-to-brother programs and behavior change facilitators. All these programs really talk to addressing these key populations. But we don't want to regress on the gains we've made on the general population. So our programs as National AIDS Council, as Ministry of Health and Child Care, together with our partners and the people living with the HIV network, we make sure that we don't regress on the gains we have made so far. I'm also glad to tell you that tomorrow we'll be announcing the results for the Zimbabwe HIV prevalence and incidence study, which was done in 2019, and it will be announced tomorrow. They will really be telling us where we are as far as the pandemic is concerned. But you know, the last mile is the one which is difficult to deal with. So we are putting all hands on the deck to make sure that we achieve the 95 for 2025. And despite the effects of COVID-19 on the globally. But we have also noted that as Zimbabwe, we need to now, we've noted that our health systems are fragile and they are not very sustainable in terms of funding. So we need to seriously look at, besides the resources which you get from our international partners, we need to domestically finance our programs so that there is universal health coverage in Zimbabwe and everyone is covered.
All right. Thank you very much, Dr. Madzima. Now, of course, we are going to take a very quick break, but don't go away. When we come back, we are looking at the mother-to-child transmissions and the impact, of course, on the fight against HIV, as well as the importance of prevention of mother-to-child transmissions and the success rates in Zimbabwe, particularly. Now, this program is brought to you by Zimpapers TV Network with support from PEPFAR through USAID in partnership with OFID and NAC. Don't go away. We will be right back.
It's
Welcome back and thank you for joining us as we continue with this discussion on World AIDS Day, which we will be commemorating with the rest of the world tomorrow. Under the global theme, Global Solidarity, Shared Responsibility. This broadcast is brought to you by Zim Papers TV Network with support from PEPFAR through USAID in partnership with ORFID and NAC. Now, just, to pick up from where we left off before the break, Clarence, maybe you need to explain to us, what is the significance of this particular theme for people who are living with HIV/AIDS, also for those who are not HIV positive. But we all know that, as society, if we're not all infected, we are all affected one way or the other. We do know people who are. So what is the significance of this theme?
Yeah, thank you so much for that question, Candice. So for people living with HIV, the theme itself shows, or at least recognizes, the contribution of people living with HIV to effectively ending the epidemic. People living with HIV are not vectors of the spread of HIV, but actually have a role to play in terms of addressing the existing gaps within the response to HIV. So it's a very apt theme because it really honors and recognizes the contribution and the potential of people with HIV with regards to effectively attaining the last mile targets. For the rest of the community, the rest of the population, it also recognizes that the responsibility is shared. Both people with HIV and persons who have been affected by HIV, as well as people who are not infected, we have a huge role to play. It's the shared responsibility. No one has to blame the other, but rather we need to put boots on the ground and push to ensure that we attain our 95, 95, 95. And that can only be done through that collaboration, that joint effort from people living with HIV. And people living with HIV are more than ready. They've done that before and will continue to do so. In any crisis, there are always first responders, and what we know in terms of the HIV epidemic is that people with HIV have been at the forefront. And this theme recognizes that people with HIV and communities have been at the forefront and will continue to be at the forefront. As we head towards epidemic control, maybe others will step aside, but the communities will remain, people with HIV will remain. And we will be there to continue to share that responsibility and ensure that we sustain the gains that have been made to date.
All right. Thanks a lot, Clarence. Now, Dr. Madzima, one of the key things that has been talked about as we talk about reducing the numbers of people who are, the new infections rather, of HIV and AIDS, one of the biggest things that has been pushed for is the reduction in the transmission of HIV and AIDS from mother to child. Why is this a particularly significant issue that needs to be addressed?
Thank you. So the elimination of mother-to-child transmission program is one of the programs which Zimbabwe started early on as it started to respond to the HIV pandemic. And this is critical because here we're talking of the future generation. We know that babies can be infected in utero, during delivery, and postnatally. So what we have done is we started with these programs. Initially, there were different regimens which were used. But now what is happening is that once the mother is diagnosed as being HIV positive, they are put on treatment for life. Mm-hmm. And we know that this protects both the baby and the mother. And we also know that various other things which are done, like exclusive breastfeeding, ensure that the baby remains safe. So this is what Zimbabwe has done with the elimination of mother to child. But one of the things again is that Zimbabwe is one of the countries which is on track to achieve a process which is called validation. Mm-hmm. What we mean by that is that we reduce our mother to child transmission to less than 5%. So we are on track to achieving that. At the moment, the last statistics talk to around 7%. But even then, we have really tried to look for those babies who get infected through mother to child. But our statistics, some of them are based on modeling. But we also have to compare with real data, which we collect. And we think we are doing very well in terms of reducing mother-to-child transmission. And we are on course to being validated as a country.
Okay. Now, Patricia, as one of the leading partners in the fight against HIV and AIDS, I know that OFID has a program that they have been running to just kind of add to this prevention of mother-to-child transmission agenda. Could you explain a bit more about that program to us?
Sure. So OFID works in partnership with ministry, like I mentioned, and OFID itself is prime for a consortium that is funded by USAID, where multiple partners are led. And in the past phase, we've worked with Kapnik Trust and a few others. And going forward from October, like now going forward, next 5 years, we've got ZNNP Plus, working with OFID as well as Kapnik. So this partnership, working with ministry, helps us to spread across many facilities. In the past phase, we've supported 672 health facilities in 24 districts, and managed to make sure that at least 523,000 clients were put on treatment. Now, when you look at antenatal clinic, we've made sure that to support the ministry policy, all mothers who come for ANC are tested for HIV as long as they don't know their status. And it has proven that, in fact, almost everyone, every pregnant woman who approaches the facility does not leave untested. They know their HIV status, or they already knew it before they came on. So after that, we also support the ministry to make sure that mothers achieve at least 4 visits minimum. You know how, with social issues where they may not have access to finances so they can be regular customers, but at least to make sure that they achieve 4 visits of antenatal clinics, where, like Dr. Madzima mentioned, that if they are HIV positive, then they are put on treatment for life. And that sort of reduces now the chances that they would transmit HIV infection to their babies. So that program of PMTCT is actually, as mentioned earlier, is shown evidence that we could be heading for elimination of HIV in Zimbabwe, and obviously researches and validation will be able to show us exactly where we are. So it is a very successful program for PMTCT, and we've celebrated babies, many babies who've been born HIV-free.
All right.
Which is very important. And also taking from what my colleague says from ZNP Plus, that partners who are HIV positive have also come on the table to make sure that they also lead as men to support their women, so that they make sure that they themselves are retained on treatment and are not necessarily passing new infections to the mothers. So it is a very successful program from the way we see it as partners working with the ministry, where PMTCT has really helped us to keep down the new HIV infections.
Okay. Now, when we look at that, though, so we do have sort of the structures in place, may I say, but what about the actual healthcare facilities themselves? Is OFID involved in any way in trying to strengthen the healthcare systems themselves and the facilities to ensure that it doesn't matter where an expectant mother or a new mother goes to, they're able to receive the care, the attention, the medication that they need without having too many hassles?
So what we've been focused mainly on is on human resource capacity development, to make sure that the health facilities are staffed by HR, what we're calling health resources, human resources for health, where we actually make sure that facilities have got adequate staff in as far as possible in strategic places, in ANC, in HIV, where we support issuing of medication of people of drugs, the OI art clinics, so to speak. We make sure that there are focal persons who are always there, so that when clients come in, they will not go away without having been attended. In fact, we've trained people living with HIV to be posted to facilities where they will help clients who come in so that they are navigated through the health services system so they don't get lost along the way, to make sure that at least they are aware of their HIV before they leave the facility, to make sure that if they came to take medication, they are chaperoned through, to make sure that they get to the right places where they can actually have their medication supplied to them. If it's about viral load, where our staff will actually support the Ministry of Health to make calls where patients have not turned up, whether it's for viral load checking, whether it's for drug pickup. They actually now we support them, yes, to follow up, to make sure that they make a call. And now with the community program that has been introduced this year, we're actually now making sure that there are also people living with HIV who are on the ground as agents to follow up the households, to make sure that if people needed the test, they'll be tested. If people want drugs, they are taking them. And they are encouraged also to come up with groups where they support each other as peers, and take it in turns even to go and collect medication for a group. So the facility and the community alike, the loop is now complete, where we are saying, all the milestones of making sure that people are retained in care are followed and maintained.
All right. All right. Now, Dr. Mazima, the Zimbabwe National HIV and AIDS Strategic Plan of 2011 to 2015 saw the country adopt a combination prevention strategy approach, which focused on the number of areas to prevent new infections. This approach included the prevention of mother-to-child transmissions. It also involved voluntary medical male circumcision, behavior change communication, condom programming, and STI management. How effective have these approaches been to the program as a whole?
Thank you for that question. Yes, like I said earlier, the program has really done very well. It has matured. Zimbabwe is on track to achieving the 90-90-90 targets. And also tomorrow, we'll be hearing the Zimfia results. So that would be a platform where people can then do their analysis and say whether we are doing very well or not. But those interventions, the one which you have mentioned, they remain critical. The circumcision, the behavior change facilitation, and on top of that, we have added the other models which I talked of, which target the areas where we think the pandemic is still rampant. Yeah, so we continue to maintain those programs, the elimination of mother-to-child, the elimination of syphilis, making sure that the country is validated in terms of those the targets which we have set. But we want to make sure that whilst the general population is safe, the key populations also have programs which target them and resources. One thing which we have done is we are now mapping the disease in Zimbabwe. We want people to be reporting on incidents. We want people to be reporting on prevalence, and make sure that we are targeting the areas where we think the pandemic is still not in control. But yeah, we continue to have all these interventions in place.
All right, thank you. Now, Clarence, in your in your involvement with people who are living with HIV, especially continue to look at the pregnant mothers and new mothers, how accessible have these facilities been for them? How accessible, how easy is it for them to get access to medication, counseling, and everything else that they need to be able to positively live with their conditions?
Thank you for that question, Candace. So with regards to the community of people with HIV, and in particular the issue of the elimination of mother-to-child transmission, we do acknowledge in terms of the contribution or the resourcing of that program from government and also other players, including OFID and particularly USAID and the Global Fund. But there are definitely challenges, and these are the challenges that probably, as we're now heading towards epidemic control, we need to really address. So from the perspective of people with HIV and particularly mothers, there are a number of issues that we need to look at. One would be the issue of those out-of-pocket expenses. Yes, probably the service is free, but you have to pay your bus fare to get to that facility. So not everyone has that US dollar, $1 or whatever bond price it would be to get to the facility. And those are things that we need to look at to ensure that all mothers get to the facility and receive the service. Also need to look at the society, community aspect. There's still stigma and discrimination within society, and there's need to address that so that women can present themselves and also men can be available and support their spouses at the facility. So there are still challenges that are there. The healthcare workers themselves, they are well-intentioned, they are really working hard, but they're also understaffed, so definitely the care might not be exactly what would be desirable. So they are overloaded in that aspect. So we need to really look at those challenges and work on those challenges to ensure that every pregnant woman can actually present to the facility on time and be able to receive the necessary care, because it would be really a great travesty to have the support that we get and not have women present on time. Yeah. This is the one key aspect that we really want to push as we head towards epidemic control. We need to have all women present on time, and we need to look at those challenges one by one to actually address them. So stigma and discrimination, out-of-pocket expenses, they do come in to really hinder women from accessing the services.
All right, thank you so much, Clarence. Now we are taking another short break. However, when we come back, we will be looking at policies. Are there enough policies in place to help push forward with this global theme? So do stay tuned for that, as of course this broadcast is brought to you by Zimpapers TV Network in partnership with PEPFAR through USAID in partnership with OFID and NAC. So please do stay tuned. We will be back shortly.
I've been living with HIV for the past 6 years, right? Mushonga mkuru ukusimba kwandakaita adherence. For the past 6 years, I've been adhering to my medication, taking my medication at the right time, with the right liquid, right dosage. Saka chimwe chobatsira nutrition, kudya zvinhu zvinovaka muviri. Kuvaka muviri hazvirevi kudya zvinhu zvakazara mafuta, kwete kana mufushwa wekumusha uya une mafuta mashoma, nokuti kana munhu uri paati tine piritsi rinonzi efavirenzi, piritsi raidanane nemafuta. Ukadya zvinhu zvine mafuta akawanda zvoreva kuti piritsi harizoshandi zvakanaka mumiri mako, zvoreva kuti utachiwana unogona kuramba uchiwedzera muropa mako. Saka ukadya zvinhu zvine mafuta mashoma, zvinhu zvinovaka muviri, chimwe chinhu nokuexercise. Kuseni kwega kega ndotombobuda ndichimhanya pano nepapo ndichimhanya, une kusimba kwandakaita. You can't believe it that I'm HIV positive.
Welcome back to this discussion on World AIDS Day. Of course, the global theme this year is Global Solidarity, Shared Responsibility. This broadcast is brought to you by Zimpapers TV Network with support from PEPFAR through USAID in partnership with OFID and NAC. Now, we just watched Samson. Samson Banda is from Matabeleland South, and he says he has been living positively with HIV and AIDS for 6 years. And he's one of many stories that we now have to tell. And I think it's a positive move forward, considering that at a point in time, people were ashamed to say openly that, I am HIV positive. Now, Patricia, you did mention that there is the Face HIV program that OFID is running. But what other programs are there for people like Samson who are living positively and just need resources to tap into, or people who live with Samson and are negative, but they also need to be able to have access to this information about how to deal with somebody who is living with HIV?
Thanks very much for asking that. I think it's very important that when we look at HIV, we are not stigmatizing it, because it is here. And only the other day I was talking to Clarence in Shtungiza, and I was saying, gosh, I was here in 1991 with the first home-based care program. And today we walk in the corridors of the health facilities. There are not so many ill people. So we are fortunate that the policies that we are given will actually guide us to make sure that once someone is on treatment, there are protocols that they need to follow. We are allowed to give them now about 3 months supply to take home, to make sure that they are familiar, and also it's almost like a family affair, where the families are also brought in to make sure that they support this person living with HIV. And it's not so much about the length of life, but the quality of it. Hence, we also talk about the issues of adequate diet, the issues of adequate rest, the issues of reducing stress, psychosocial support, and so on. So there are other programs that are what we call wrap around the main HIV program, to make sure that the person who's diagnosed with HIV is educated, they own their status, they prevent further spread of HIV by making sure that they maintain their viral load suppressed, by making sure they are constantly taking medication. They are so aware about infections. You heard Dr. Madzima talk about STI. You know, so we don't compartmentalize ailments. We make sure that, you know, when the client comes, they are saved, and they make sure we ask, you know, the broad question, if they are feeling well, if we needed to attend to any sort of new infection that is coming on board, whether it's riding on their likelihood of low immunity, they are also then given service. We are looking at TB treatment, for example. We are looking at even the COVID. You know, during the lockdown, we classified as providing essential services, where we made sure that we ran around to supply PPE, to make sure that there were sanitizers in facilities, so that we don't get people falling sick because of COVID. Then if they were HIV positive, they will be doubly compromised. So there are a number of other programs around HIV that we make sure that we keep them going parallel, sometimes integrated, to make sure that the person with the unit is free of other, you know, headaches. If they were HIV positive, they know that area is taken care of. But what about the rest? And we are also looking at coordinating with community programs like DREAMS that have livelihoods for adolescent girls mainly, and also, you know, there are other that attend to boys and men. So the programs are so integrated that we have coordination meetings using the health facilities, the planning unit, so that partners who are working in different other programs come together, share notes, and support each other to make sure that this individual who is HIV positive does not spread, or the family or anyone else who is negative, for that matter, stays negative because they've got adequate information.
All right. Now, Dr. Madzima, we've got all these initiatives and all these programs that are meant to support people living with HIV. And yes, our numbers have dropped significantly, but we still have large numbers of new infections as well. What are the challenges, especially when we now look at those hot pockets that you spoke about earlier? What are the challenges that we now need to start tackling head on, probably one by one, if we are to reach this 90-90-90 goal?
Yes, so the goal for the HIV program really is to make sure that there is, by 2030, there are 0 new infections, new HIV infections. There are 0 deaths due to AIDS. Then there's 0 stigma. So when we do all these programs, this is our vision, to make sure that we have that situation in 10 years' time. So like my colleague has said, there are these community programs which we also participate in. I'll give you an example where we even use artists, musicians, poets, drama groups to spread positive messages about HIV. We know that in the early decades of HIV, even some musicians would sing songs which sort of put blame on individuals that they've contracted HIV. But because of the continuous learning which is happening, we now know that the messages are really positive messages which make people, stay HIV negative if they are negative, and for those who are on treatment, it makes sure that they continue to get the treatment, and it even makes sure that people do not stigmatize the disease. So these are the community programs which my colleague alluded to, which we support ourselves as National AIDS Council, as Ministry of Health and Child Care, as CSOs, for example, ZNNP+. We, as NAC as well, we are going to be supporting what we call social contracting through ZNNP+, to make sure that the CBOs, those organizations which are in the community, we support them in terms of resources so that they carry out these community programs, whether it can be coordination meetings, it can be peer-led teachings or educational programs which happen, it can be IEC material, it can be local radio stations. You know that now Zimbabwe has got local radio stations. So we want to use all those platforms, the social media itself, to make sure that, and commemorating, like what we are doing now to commemorate World AIDS Day, to create that awareness that we don't have to discriminate, we don't have to have new infections, we don't have to have any AIDS-related deaths because the treatment is out there.
Okay, but you haven't answered me specifically, Dr. Mazima. I was asking, what are the challenges? What hurdles are we facing in heading towards achieving this goal that we've set? Where are we falling short? Because we still do have new infections occurring. We still do have deaths occurring. What are the challenges in that?
Remember, we talked about what we are calling key populations. This is where the HIV infections are still high. I'll give an example of maybe even in terms of policy or legislature, which maybe makes it difficult to access certain populations like the MSM. But we are working with the government, we are working with parliament, we are working with the civic society to make sure that we access, they access services. We have got what we call drop-in centers, we have got mobile clinics, which we are working with our partners to make sure that those key populations, which might not be socially or culturally acceptable, but we know that they are there. We don't turn a blind eye and say they are not there, and when we know that they are there, and they even go further and interact with the general population. So this is where the hurdle is. The hurdle is making sure that we access even the artisanal miners, where they go and stay. Sometimes there are no facilities, and they cannot access drugs, they cannot access commodities. So as a government, we have to identify those and make sure that we target them and we provide services to those populations.
All right. Clarence, how has COVID-19 changed the way in which you interact with these support groups for people living with HIV? And also, how has it maybe had an impact, if you would know, on our statistics in terms of infections and deaths?
Thank you so much, Candice, for that question. I think it's a very important question because we're still facing COVID-19 and it has changed really the way everyone operates, and people living with HIV are not excluded from that. First and foremost, in terms of accessing treatment itself, I think there have been changes. You'd remember initially probably in terms of COVID-19, movement was limited. And that in itself really presented a huge challenge in terms of people living with HIV accessing treatment at their preferred facilities. So what would then happen is that, well, through the Ministry of Health, they also gave them the guidance that clients in care can actually access at the nearest health facility, which brought relief. but definitely in terms of accessing treatment, that has presented a challenge. Secondly, in terms of meeting, support groups normally would meet physically and would interact and provide each other with psychosocial support. But because of the regulations, meeting has not been that easy. And in response to that now, you'll find that a lot of groups are now also, forming WhatsApp groups and meeting online. But that also is a challenge in that it mainly probably will assist, or at least cover those who have access to internet, who have access to these social platforms. But it leaves out a huge group that don't have access to that. They have your Mbudzi, your small phone, that doesn't really get access to internet. So what we've also done ourselves is, with support from our partner UNAIDS, they've actually helped us to set up a call center where people with HIV can call in if they have any issues. They want to know where they can go in terms of the facility that they can go and access their HIV ART or TB meds. So that's how we've also now started trying to respond to COVID-19. So we've gone virtual ourselves. We've also tried to push our members to also go virtual, but definitely there are still challenges in making sure that everyone is fully covered. But with our call center, the Kutawila platform, we've tried to capture those who do not have access to internet.
All right. Now, unfortunately, we are out of time, but I will ask us, as we conclude our discussion today, to just give our thoughts as we commemorate World AIDS Day tomorrow. Of course, our theme, Global Solidarity, Shared Responsibility. What would be your final thoughts on how best we can all come together in this fight against HIV and AIDS? I'll start, of course, with you, Dr. Madzima.
Thank you, Candice. So maybe for me, really, is to just alert Zimbabwe that tomorrow's events, there's going to be a very small event because of COVID-19. Otherwise, the rest of the program will be online, will be virtual, and people will have to log in and participate. But otherwise, we continue to put our hands on the deck to make sure that we achieve the targets of 2030.
All right, thank you. Clarence?
As people living with HIV, we are more than ready to share the responsibility, as the theme really puts out. As communities, we are at the center. We will continue to push to ensure that we support the 95 targets, and I know with the contribution of communities that is possible.
All right, thank you. Patricia?
Thank you, Candice. Just to say, is we are also looking at issues of gender, that we've gone through a lot, COVID lockdown, and the issues of HIV know no boundaries. So I think it's important that we are kind and be very gender sensitive, that those young girls who find themselves subservient to their male counterparts, that they are treated equally and that they are treated with dignity, and that they are not exposed to new infections because they are poor and so on. So, and also we've got this program we are supporting in the Ministry of Health facilities to make sure that we ask key questions to eliminate gender-based violence, which can exacerbate HIV new infections.
All right, thank you very much. Thank you for joining this discussion on HIV and AIDS. World AIDS Day is tomorrow, and we will be joining the rest of the world in commemorating it. Of course, the theme this year is Global Solidarity, Shared Responsibility. That basically is a call to every single one of us to play the role that we can to ensuring that we are able to eliminate HIV and AIDS within our communities by 2030. Now, of course, this show was brought to you by Zimpapers TV network with support from PEPFAR through USAID in partnership with ORFID and NAC. My name is Candice. Be kind to each other, but be kinder still to yourselves. We'll see you next time.